Hello, guys. Good morning, afternoon, evening. So, finally, I am back with expending 7 hours continuously on this since from yesterday and a lot of cup of coffee. Not a coffee, I prefer tea. So, finally, it's ready, and I'm back with you all along with newer uh, application which is open right now. HBNU Fogarty Global Health Research Training Program. The HBNU is directly the name has been given based on the four university, as you see that Harvard University, Boston University, Northern Western University, and the last and very close to the Harvard University of New Mexico. Now the application for 2024 and 2025 is open. So let's start with this and hope positive for this opportunity. And always we should have positive vibes, whether it's going selected or not selected, but at least we have to fill these forms, and one day it will come that we all will get any of the opportunity, something which will be a big ladder for our career goals and achievements. That's it. Let us start. So HBNU is open, and the key point here is fellowship opportunity is directly available for the 21 sites, that is specifically that the college which is leading directly in the public health pioneer institution whole in the world, and specifically varied in based on the different countries, and which is coming for 14 countries. But unluckily for, as we are from India, so in Southeast Asia region only two countries is coming. So from India only one college is over there, so we will discuss deep on that. Fellowship includes research funding, stipend, likewise depending upon the awards, deep we will discuss. And after the selection, the appointment will begin July 1st of 2024. You will be get if you get be selected, and then you will be going for some of the broad at campus of NIH at Maryland. So that will be week-long orientation. That will be very good opportunity. I think that's so. And it will be based for 12-month oriented and mentored with the highly reputed mentors and well trained and skilled developed leaders under that. If selected, then we have to get the mentorship under that. Some of the details regarding this training program. The Fogarty Global Health Training for they provides 12-month research fellowship, especially for low middle income countries. And we are one of them from that countries belonging from them. And likewise, this fellowship is sponsored by FIC, that is Fogarty International Center, and several collaborating institute, as we have said that the four countries, four institution based on which the name has been given HBNU, Harvard, Boston, ULS, and UNM. The program directly support, likewise the program expect, and they expect from us that we have to submit our concept note and proposals under varying from these domains only, and majorly these domains: HIV/AIDS, non-communicable disease, mental health, maternal health, child health, and nutrition. Apart from this, if you are having any of the specific domain, then it's also open to submit that your proposals, but it will be majorly they are asking in these domains, and submission of our proposal in these domain will be highly effective, appreciated, and greater chance for the acceptance rather than submitting in any other core area. But it is not likewise fixed on these five only. We can submit in that as well. But as per me, uh, likewise every person have different type of taste. So on that background, everyone is having different core of interest. But I think that's okay. Non-communicable disease, specifically for the India, as NPCDCS program, a lot of thing is running on. So I think that so this will be the major core area. Apart from this, maternal health is always a choice of interest because of deliveries and total fertility rate, maternal rates, infant deaths, that likewise ki it's we have to, it's improving, but a lot of the things is needed to work in this. Specifically, if my choice will be there in the maternal health, I am working and I am keen to work on this. Specifically for respectful maternity care, a lot of things is needed to work in this background still now. So as of things, so I think that's okay. A core area is a very broad area. We can submit is rather than going any newer areas of proposals. Apart from this, like, as we have discussed that it has been sponsored by Fogarty International Center. So, fellowship connects a high potential global health researcher with innovative ideas, mentored with highly reputed mentors who is working in these domains, more than 20 years of experience, and it gives us a research opportunity to improve the health of low resources population around the world, specifically the sustainable developmental goal which has been came, and we are expecting to achieve that, as well as that key low LMICs are most focused on that, having focusing in these core five area, especially maternal health and child health and non-communicable disease. While working in these areas, we can work more better and we can achieve the target 3 which has been given a sustainable development goal. So this will be a great collaboratory and high potential global health research, along with the mentorship of leaders. So they have created a consortium of four universities, as we have discussed previously: Harvard, Boston, Northeast, and UNM. So based on this, they have given 21 partner institution. So we will discuss that as well. So that is a great chance for this. Varying for major of the universities, they have given specifically in the African region. So you can see that ki specifically the countries Botswana, Ethiopia, Ghana, Kenya, Mali, and likewise ki Nigeria is getting most of the universities in their hand. Apart from this, the second running is coming from the South Africa, but we have to hope better for this. Apart from this, Rwanda, Uganda is also over there. So we can say that ki Africa is alone itself, it's taking 11 of the institution in their hand. Now the next we have to go the remaining one, Southeast Asia region. So for the Bangladesh, it's achieving for the one of the institution, which one is the top tier over there, is working on the specifically on the diarrheal disease research. And while coming to the south of America, only one institution is Peru. And the last but not least, very close to our heart from the India, that is PHFI and CCDC. So we have to likewise key for the international mentors, the international proposals has to be work under the two supervisor or two mentor. We can say that one will be based on the international, that top four institutions which has been named previously: Harvard, Boston, Northeast, and UNM. And the second one we have to check out. We have to choose our mentor from our country, specifically from the PHFI and CCDC. A great institution, a top tier institution, likewise ki, uh, a great guidance will be from here. So, so some of the likewise ki when we are going for any of the newer thing for applying or doing any of the research, or even applying for the job, then also we have to go through that website and key out key what's going on, what the key areas, and what is the percentage ratio, and that all we have to do that research part. Sorry. Apart from this, while when I was going through this fellows and cohort and dragging out to track out that number of Indian students who have got selected, so it's too shocking for me. Even it will be shocking for you also, that from the cohort of 2020 and 2021, no one is from India. Likewise, ki It's a very keen area that we are working in the every field. We are achieving awards in the crickets. We are on the sky, and at every field we are performing like bloom. So why we have to step back on these areas? We have to achieve this also. Being an Indian, that we have to reach at every regions. Nothing is hard for us. So we have to get in the cohort of this fellowship, hoping for the best. I think any one of us will appear for this, will achieve for this to fulfill the gap of last 3 years. That in 2021 and 22 fellows, you will see that only one from India has been selected, and that is also from the US fellow. She is Indian, but from what she has got selected for this from the US fellow. While when you come from the 2022 and 2023, a series is over here, and a last cell which is not, I think that's so, which is not visible to you. Sorry for that. That is written plus 7 more. Likewise, ki this number of fellows has been got selected. Specifically, you will seeing that ki they all are coming from likewise ki African region, basically because 11 institution is directly 18 institution and 11 countries is from Africa. So that might be one of the region, but we have to rework, rethink, recreate, reapply on this. So 2022 and 2023, none of us were here for the achievement of this. And the same is here also. 2023 and 2024, you can see that ki Ghana is also over there, Kenya is also over there, and likewise ki Zambia, Uganda is also over there. But what is the reason behind this? Either we have not applied for there, or we have rejected over there. I think that's okay. The percentage of application from Indian national and likewise ki Indian fellows is might be, it's I'm expecting, it's my personal views that we have applied very less, so that's why our representation in these areas is very low. So let pledge that the applicable people from India, that they will apply and get a good chance and represent our India in this cohort and this fellowship as well. Even at the Boston, even at this Harvard, even at the Northwest, even at the UNM as well. With this fellowship, a lot of Indian national are working over there. Indian national are studying over there, but getting this fellowship and representation in this cohort is a lot, means a lot for us, that we have to go for this. Now, specific for this research aspect, as we have already discussed that the core area and the proposal has been asked in the field of HIV/AIDS, non-communicable disease, NCD, likewise ki, they have more defined for cardiovascular and diabetes. Apart from this, a lot of things will coming in the NCD. That is a not area to discuss over here. Everybody knows about that. So, mental health is also over there. We can think about that. MNCH, likewise, ki over here, maternal health is another part, nutrition and child health is another part. We can do a lot of things over here, and we can align our proposal in this way so that different aspects can be touched. So, if two of your colleagues is planning to submit this format, so try to submit your proposal in different research domain. Do not submit in the same domain. I will prefer to submit in the two different domains, so getting the chances is more high. So the deep digger in this financial support, that 12-month stipend, that will salary funding will be depending on the type of award it will be provided. And low middle income countries fellow will receive a fair and equitable stipend at a PHFI and CCDC, so that can be worked out. Apart from this, support and fundings will be given on the research. Likewise, ki, while doing a research work, if you are going through a qualitative research or quantitative research, so at least yeah, you need R, might you need SPSS. So a lot. Likewise, just I'm taking this a very known softwares. A lot of softwares is over there which I'm also not knowing, that if you need during this fellowship, then you can receive some of the fundings to achieve that. Apart from this, likewise ki submitting your research paper after the completion, and if you're doing any of the review papers, that is systematic review, meta-analysis, anything, so that can be also published. And while publishing any of the papers with the like with Scopus Index Journal, MDPI, and a lot of journals, so there's charges high and the cost in the US dollar. And likewise MDPI is charging 1100 CHF, so that amount can be uh, funded from the research support accounts, so that can be achieved for the publication finally. Apart from this, in during this fellowship, you have to visit Maryland. Apart from and also, if you are taking any of the international implementation area, so airfare and accommodation you will be provided. As we are from India, if we are going to be selected, that round trip to and fro moment of the airfare will be provided. Apart from this, visa processing charge, that is very hard to reach for the Indian national. Likewise, a lot of people has visited UNM. So getting even selected over there, then also not having the processing of visa. So a lot of people have missed this chance to visit over there, UNM. So they will provide this assistance in the visa as well as in the passport fee as well. That will that will more than better on the but that will work. So coming for the next part, that is mentorship. So in the part of mentorship, each component likewise ki each applicant has to check out that two mentors. One will be based at internationally. That will be from these four institution which has been the name has been given in the previously. That is Harvard, Boston, Northwest, UNM. Apart from this, mentor, international mentor and Indian or based country mentor will give you support on your proposals, implementation, any queries on that, research methodology findings, implementation on that, institutional review board approvals. Apart from this, anything whatever the support will be there, a great level of mentorship and support will be provided. So, supporting documents, likewise, you need to submit in the fellowship that two of the supporting document from your both of the mentors. One is internationally and one is from your own countries. That is a very essential document. Without it, you are not able to proceed for submission of the form. While a fellowship program component varying from that week-long orientation will be held at Maryland. And as we have previously discussed, it is 12 month of fellowship. So in which you have to work 40 hours per week. That is 8 hour per day. It will be varying. Short term, that is not applicable for us with the Indian nationals. So, but the short term fellowship is also being provided for the specific that people from these four institutions over there. Mentor teams, as we have discussed that two mentors we have to select. One is from India and one is from international, these four countries. And regarding funding supports, research submission, and research tool, as well as online seminar that you have to attend, international seminar you have to attend. So some of the cost processing that it will be provided as well. Apart from this, for any of the online platform, you want to get that access, so they will provide this submission on that, and you will get that free account over there, so you can proliferate a lot of paid courses freely. And the last research and technical, a lot of the things, even you are very leading professionals in the part of research, then also at every nook and corner we need guidance and we need support. So I want to share one of my example that one of my friend has likewise completed his systematic review and meta-analysis on one of the part of the vaccine research paper, and that research paper he is still working at Naipur at Hajipur. So he has submitted that paper in the I think that's okay at least five of Scopus index journals. So the first step that editor of that journal what they did, directly they have rejected. Neither they have taken for this any of the review or any of the suggestion to track out. They have directly rejected for that. So some of the part is over there that the guidance at every nook and corner has been to be needed. What is the research methodology you are going to use? What is the search strategy you are going to use? What is the sampling technique you are going to use? What is the questionnaire based model what you are going to use? So a lot of the things is needed over there. So at every point of view, we need a guidance. So at every nook and corner, we have to be in the touch of a guide, supervisor, mentor, coach. Either he is from representative for your institution of your country or one international. So we need at every nook and corner we need a support. So that we have to take care of that. So the most important thing aims toward that the fellowship will be provided to whom. So for the Indians, so for the Indians or for this any of the fellows who are coming as a representative from low middle income countries who are citizens of one of the likewise HBNU collaborating LMICs, which has been shown over here that these institution based in these countries, so must be from these countries only. Uh, and beginning date to the training a PhD, MD, or a comparable doctoral degree from accredited institute, matlab reputed institution who has been recognized and accredited from AI as per the Indian norms, so that when they are cross checking, so it will get over there. Two more thing is over there, US pre-doctoral candidates as well as US post-doctoral candidates will be also provided. So LMIC, the next thing is LMIC postdoctoral candidates. Likewise, we are coming from the third part, the LMIC postdoctoral candidate, more defined in the below one. So, a citizen of one of HBNU countries, likewise, which I have shown. So, we are coming from that as PHFI and CCDC from India and Delhi only, as well as they have the applicant has received as our beginning date of the training of the period a PhD, MD, or comparable doctoral degree, any of the accredited institution. So only this is not limited to this, and other thing has been also defined over there. Likewise, ki DMD, likewise ki Doctor of Dental Medicine. As of now, I have not got in touch of any of the person who have did the DMD. I know a lot of people who have done this MDS from KGMU and from Delhi as well while studying my Master of Public Health at Allahabad. So if anyone have done so that will be applicable, while DC is doctor of chiropractic, so that is also over there, and DO is osteopathic medicine. So I don't know any of the persons who have this degree, but the last three will come for R. Likewise ki DNSC, doctor of nursing. So a lot of people is doing some of the while I was working as a district technical specialist based at CMO office Gonda. So some of the nurse mentor under me, they are they did BSc nursing, MSc nursing from Madhya Pradesh. Right now they are pursuing their PhD as well. So they are applicable over here. Apart from this, Likewise, ki Form D is also applicable over here. Likewise, Doctor of Pharmacy and Doctor of Naturopathy is also there. DSW is over there. Ki Doctorate of Social Work. I know three of the people who did MSW from BHU and they did doctorate as well. While doctorate in psychology, one of my colleague Nitin Anthony, he did MPhil in psychology. But if some of the people has did this doctorate in psychology, they are applicable for this. So as we have already discussed that it is a 12 month varying fellowship that will require, if you will be going to be selected, you will be required to pay a 40 hour per week that you have to work on this. So, as we are from India, so in India, only one institution is tagged with this HBNU, which is PHFI and CCDC. It is likewise ki PHFI is do not require any of its introduction, but at least 2 to 3 points is over here that established in 2006. Apart from this, PHFI is Premier Center of Health Research Education. Likewise, now government is also having collaboration with them. Like one of my friend working as ophthalmologist, recently they have got a troop of ophthalmologists came at PHFI for the training. In the various part, they are playing a great role. CCDC has also aligned with this, and they both is collaborating as an international part, including Harvard Chain School. And one more thing I want to share that sorry, recently they have did in the last year of the November uh, one of the course, likewise we can say that 4 day daily base session was over there on specifically on environmental epidemiology and cardiovascular health. I have got the opportunity to attend that. So a great skill that adorable we adorable a great level of guidance and learning and teaching skills they are having. So some of I have met personally over there. So I will recommend you all to fill this form and proliferate whosoever it may be eligible for this. So do not hesitate to reach them out. Do not hesitate to fill the form. What will happen? Either it will be selected or it will be rejected. Nothing any other part apart from these two. So we don't have to frighten. We have to go for this both of these things. So we have to fill this on and proceed towards it. Likewise, key leadership and expertise whom to reach out at PHFI for any of the guidance and that recommendation letter you needed to submit it while filling this fellowship. So site directors details Dr. Salesh Mohan is over here. You can directly reach them out. Site mentors Dr. Monica Arora, Dr. Goinika, Dr. Arun is over there. Dr. Dimple Kondal, Dr. Shyamlana Krishnamani, Shyamala, while Professor Dilip is also over there. Likewise, if specifically for the if you are planning any of the things like in the maternal health, let's say if you are submitting your proposal that how to overcome how to achieve that sustainable development goal of maternal death in Uttar Pradesh or in India or in Delhi or comparison. So you have to reach out Dr. Dilip and specifically to this, if you are going for the NCD, that you have to reach out the Dr. Monica Arora. In the specific field, you have to reach out that concerned person who is working in these areas so that they can provide you a letter of mentor. If you are reaching to Dr. Dilip and submitting proposal in the field of NCD. So directly they will either reject or you will or they will reroute you to Dr. Monica. So directly it will be better to directly go to them. While on the leadership, personally I have met Dr. Durai Raj Prabhakaran. So That's a good, it will be a pleasure to work under the leadership of these people. So that's it. Now, the very important part. So overview we know about this. So what all the document is needed during the application form and in the preparation of application component, what all the documents is needed, how we can proceed toward this effectively as the last date is coming. So before that, how we can go through it. So for these details, only two parts has been given, that one of the international mentor you have to reach out. For internationally, likewise for Indian, you can directly reach out of the details which I have provided to the from the PHFI and CCDC. But for US mentor to whom you can directly reach out, so four PI name has been already given. They are representing is specific from these four universities. You can reach them directly out, or you for the better coordination you can reach out program coordinator Lizzie Fine. Email ID is over here, and the details of application component which is needed. Let's move toward it. So the personal statements require 800 words that you have to prepare and you have to submit. A lot of things we know about that. We know that we can write, but the thing is in which direction we are writing. The way of writing is very important, that to get this opportunity a fellowship and get hit at the directly on the target, so we can got selected, shortlisted for this fellowship and opportunity. So in the personal statement directly, the broader area which we have to cover, that is introduction, we have to give out our educational background, we have to provide passion for the global health, how you are passionate toward its, you have to cover that as well. Relevant experience, that you have to track out that as well, because if I am submitting my proposal on maternal health, then I have to track it out that I have worked as a district technical specialist based at Gonda, that what I have worked over there, what the changes has been achieved in the maternal death, infant death, and whatever that you want to align with your research proposal, that you have to work on this. What motivates you for this fellowship? You have to also cover it over here. Very frankly saying that we cannot say that this much of dollar fellowship is providing, so we are coming for that. So that's directly we should not hit over there. We have to provide that what motivates us under these regimes. Likewise, what is the career role after this, getting the fellowship? What the changes will you create? What is the career goal? That will also be covered over here, as well as you have to more precisely work on a strength, that we have to also put the message very clear, that what extra we are bringing on the table, that we have to track it out. And at the last, that we have to provide that research interest and core area of us. Apart from this, what it will create on the future impact. While on the other hand, that research proposal, that we have to cover in only in the 1,000 word. That's I can say that a very hard part of research proposal, that submitting only in the 1,000 words. That you have to cover a lot of varying things in these 1,000 words only. Sorry for this. A very appealing title you have to firstly design based on your proposal, which you are which we have prepared. The title is must be very clear over there. After this, you have to provide this introduction of your proposal which you are submitting. In the introduction, you have to provide the significance of your proposal, significance of this research, and your research problem. You have to write down what you have. Next, that pre-test and pre-planning that of any of your research question, and to for any of your significance that you have to work it out and the very deep drag down that by literature review, that while doing the why we do that, this one key systematic review why we do, and the meta analysis why we do, to drag it out the gap part in these domains, so that specific domain you have to bring out in your like basically to put weightage on your significance and research problem. And like basically research in the research plan. So after this, you also need to provide this objective and hypothesis. As you are very precisely, you have designed your title for your proposal, very precisely you have to select your objective and hypothesis. A lot of work you have to work specifically on designing your objective. Likewise, the difference in objective and hypothesis is that research objective outline what you intend to achieve in your research, while this on the another hand, hypothesis makes a specific prediction towards in your research, that proposal you are submitting. So on this background, you have to very clear is provide a statement, and is very specifically you have to write your objective. And I will suggest that using a smart technique is also needed over here, that is specific, measurable, as well as achievable, relevant, as well as time bound. It's needed because as we have discussed that it's only 12 months fund, so time bound should be also over there. So if I will select that in the field of maternal health, so I will design something like to identify influencing healthcare seeking behavior of pregnant women in Uttar Pradesh or in government facilities, or you can design something like this. So a lot of things, a lot of time is needed over here, very precisely you have need over there. And then you have to describe your research methodology, which methodology you are going to use. Either qualitative research methodology will be there, quantitative part you are going to touch, or any mixed methodology you are going to use. You have to justify that why you are using specifically this methodology only. So after this, you have to drag it out that key which data collection methodology you are going to use. If I am working in the field of maternal health, so either I am going to collect the data for the pregnant women who are coming during the ANC at the CHC or at the government hospitals, or I will go personally to at their home visit for collecting the data, or I will collect the data at the PNC after the delivery of women, or I will be going after 3 days or 7 days of the delivery, that is under coming of the postnatal care, that we have to design, we have to very clearly we have to write over there. Apart from this, for the qualitative one, either you are going to do in-depth interview or you are going to do this focus group discussion. So very precisely you have to justify this. After methodology in this, we have to also put the view your views on population which you are going to take. Likewise, if you are seeking that health seeking behavior specifically for pregnant women, so your population will be the pregnant women. If you are going to seek that health seeking intervention of household, yeah, intervention of mother-in-laws in health seeking behavior of pregnant women, then your population will be changed in the two parts. So one will become the pregnant woman, and the second will go for this mother-in-laws and father-in-laws and the husband. Or you are going to collect the data for the lactating woman, as well as you have to design that the place as well, either CHC at the home or at the Anganwadis at one-to-one, that you have to take care of this. Apart from this data collection outline, after finalizing research methodology and your study population, that we have to also significantly provide this data collection outline, what when we are going to pre-test our tool, when we are going to implement that, when it's going for the mid-level intervention, when it's going to be data will be going to complete it. So that all the part you have to provide one of the chart over here, and significant out expected outcome also we have to provide, timelines we have to give over there, budget, very specifically we have to provide that number of budget, how much of budget we are going to be utilized, and what in what kind of things we are needed. So every points we have to very precisely we have to explore it out, and very actively and very likewise key precisely we have to write these proposals as well as personal statement. So, as mentorship plan, in the mentorship plan, nothing we have to do, just rather than getting one of the in the mentorship plan, that one of the approval from our four affiliated mentor universities, we have to get one mentor, and one mentor from our country, LMIC side. So we have to provide the supporting letter as well, and mentorship plan we have to submit, and we have to write it over here, and along with the details of all this, what you are going to what is your goal for the mentorship relationship, and the frequency of meeting, location, involving of each of your mentors in your research, and as well as updating that your plan, implementation areas, that what is the achievement, and that all that you have to give it over here. The most important part for implementing any of the research paper at the ground root level, that the primary paper, it's require IRB approval or ethical approval. It's a very tough task, I can say that, to get this approvals. So that's why you can say that if any other person who has written 12 of the research paper, published 12 of the research paper, then you will be going to hardly see that only 2 to 3 paper have been on the primary research paper. Every remaining research paper will be on the secondary research paper, either systematic review or meta-analysis or narrative, nothing else. So getting IRB approval a very tough task. So ethical approval plan you have to submit, that you have to provide that all the details that in the IRB application, submitting to the HBNU, sorry, international collaborator organization, as well as our based country institution as well, final approval, research, and when you are going to implement that, all these details is needed in this to get these approvals. And the last, that fellowship timeline, that you will be getting this much of 15,000 US dollar only, and in this part that you have to complete this all, as well as one more document you have to provide, NIH style bio sketch. In this you have to provide a cover details and overview of yourself, followed by detail of your both of your mentors. Apart from this, letter of support, that very specific from your both of your mentors, from your based institution, or from Harvard, Northwest, Boston, as well as UNM, their name, email ID, phone number, at this letter you have to submit. So you have to be ready with all these documents previous to getting submitted. So that coming for the personal statement, research proposal, mentorship plan, IRB plan, a fellowship timeline, that when you are going to implement this, as well as NIH is style biosketch, letter of support as well. At the last but not the least, so aim toward likewise key application information and demographics. It's a general part, as in any of submitting of the forms, it's everywhere needed, that key general personal and context information of your person, citizenship, sex, and date of birth. That's a ready to use data we are having. But the last one, uh, education and fellowship research proposal. Except from this, the last downside, wala, fellowship research proposal is very important part, and HBNU application attachment, which requires, which we have discussed already in details, personal statement, research proposal, mentorship plan, LMICs, IRB and ethical approval, fellowship timeline and budget. That all should be ready. Filling the form is very easier to us. It will not take a lot of time, but getting preparation and all this getting ready of HBNU application attachment, it will take your time. A lot of time it will take. I think that's okay. Creating writing a research proposal, that will take your measure of the time. So if you are falling in this cohort, that if you are eligible for this, I will recommend that you have to start working from today itself, as I am recording this video. So you have to, likewise, keep for achieving any of the goals, any of the thing, any of the extra parts, you have to work any of the extraordinary things that you can achieve something better. So that's it from my side, and thank you everyone for watching this. Let's catch up in some of the new videos with the newer exciting opportunity. So so as of now, let's take care. Bye. Thank you, everyone.